You're watching TVC Breakfast. Technology has greatly improved the delivery of health services, and with it, many patients do not need to go to the hospital. Treatment can be administered at the comfort of their homes. We'll be talking about the use of technology and how it is transforming medicine on one hand, nursing on the other, and all of these health services generally. Joining me to discuss the concept of digital nursing is digital nursing specialist Tosin Akinlabi. She is one of the first few digital nurses in the UK. But she's home and she's with me in the studio. Tosin, good to see you.
Good morning.
Good morning.
Thank you.
Welcome.
For having me.
Now, we hear of telemedicine. We hear of some of these, the invention of technology to help and boost health services. But when we talk about digital nursing, talk to us about that. This seems to be new around here.
Yes. Actually, first of all, I'm a registered adult nurse. That's number one.
Number one.
Yeah. So then I'm a digital nurse specialist.
Okay.
So as a digital nurse specialist, what do I do? Well, it's just like when you have a nurse specializing in diabetes, a nurse specializing in infection control.
Yeah.
I specialize in digital.
Wow.
Yeah. So one of my main role is to act as a bridge between the clinicians and the IT department.
Okay.
So using my nursing skills, experience, and knowledge to transform patient care, to improve care, to improve efficiency, and to ensure that staff or clinicians in the ward are able to free up space to care for patients.
Okay, so with this now, it creates space and time where things that you would have done in 2 hours, you can do it in 30 minutes.
Yeah.
Run us through how that works. Now, the point there is, those who are also involved, do they also have to be digital, do they also have to be in your digital space and then become specialists in the digital
nursing is a developing role.
Okay.
It's a new thing. It's just developing.
Wow.
And in fact, every all nurses or clinicians, doctors or AHPs should be thinking digital, because that's what we are moving into now. Wow. It's the era of technology.
Well, that's in the UK.
Digital technology. Yeah, even here, even in Nigeria, I was reading some news about Nigerian Nigerian health insurance schemes. Although the uptake is still that low, but we are getting there gradually. I read about Ondo State, their system during COVID, how they use virtual wards and virtual telemedicine to help their patients. Yeah. So we're
scratching the surface.
Yeah, we're starting. So now we need to get in and just move on.
So how does a patient, in all of this tele this and digital that and all of that, the patient who is the one receiving all of that care, how does this impact the patient now? Talk to us where the patient stands in all of this digital this and that.
Right. All what we do is about the patient.
Okay.
Improving patient experience, improving patient safety, and improving patient outcome.
Right.
So that's all what we do. Now, for most of the patients, they are still like, oh, no, there are issues about electronics, about digital. Most might not still be comfortable about using the system, but they know that this is where we're going. This is what is it applies. Yeah. Now in the UK, we have virtual wards. During COVID, we have virtual wards, we have video appointments. You sit in your home, you just telephone, there's a virtual connection, a software that connects you with your doctor and you. The doctor can prescribe medication, they can diagnose, all these things. So it's fast, it's efficient, and it's safe.
So everybody, we don't all have to go to the hospital and converge where you're waiting for your time because there's a long queue of patients who were there since morning, like we witnessed in some of the hospitals. Like we witnessed in some of the hospitals. It's a beautiful idea. So it means not every patient has to be in the hospital to get this service.
Yes.
Okay. Yeah. But talk to us from the perspective of services, how they pay for these services?
Well,
Because if there's a virtual arrangement, and then you want to get your you want a nurse or a doctor to attend to you where you are, and then you're connecting virtually, how do you pay for such services?
in the UK, our healthcare system is quite different from Nigeria.
Okay.
So in the UK, it's National Health Service.
Okay.
So every month when you work, you have to pay some percentage into that scheme.
Okay.
So if you need to go to the hospital to do anything, you don't need to pay.
Right.
So it's
Out of the pocket
free.
payment is taken care of.
It's taken
Okay.
care of. Unless you need to go private, but it's very few.
I see.
So that's in the UK, but in Nigeria, mostly it's out of pocket payment. Mostly people go to the private hospitals, general hospitals, or they are not really, well, they are functioning, but long
as efficient,
waits,
maybe.
long waiting lists, efficiency, and things like that. If you have the money, people would rather go to the private hospitals.
Private hospitals, and have their services, have themselves checked, and so on.
Yeah.
Now, how are people accepting this generally? How convenient it is for people? Now, maybe because I am old school, I don't know. Sometimes when you have a medical condition, you want someone who will attend to you on one-on-one, get to check you. And that feeling of, okay, a doctor or a nurse just saw me now, just examined me physically. How are people accepting the virtual thing where you don't have to be together?
It's, apart from being face to face, it's just the same. It's just like when you are having Zoom meetings or team meetings. It's just, apart from being like, it's face to face, touch and touch. The doctors could say, okay, can I see your hand? Let me see, is it swollen?
Yeah, exactly.
They could see from online. They could see,
And observe.
And
okay.
actually diagnose.
All right.
Yeah, so it's more or less the same, apart from the fact that you don't need to like physically touch. Yeah, so it works.
Oh, it's really interesting. Now, the issue there is, let's talk about the issue of in the UK. It looks like when we talk about the UK, like somewhere very, far from the realities of where we are right now, because you won't be complaining of power supply. You'll be talking about issue of data availability or network and all of that. Those things are there already, and then you also have the issue of the level of at least the minimum level of knowledge of how these things work, the digital, gadgets and equipment. That's not to say everybody knows it, but if we have to liken it back here, where you come from, back home here, how far away from those realities are we? At least you've been home, you can do the comparison of both sides.
Way far behind. So we still need a lot of catching up to do. Even in the UK, there are some trusts, there are some hospitals that there's something we call digital maturity.
Okay.
So some hospitals are still low in terms of digital maturity.
Okay.
So now compare those hospitals to Nigerian hospitals, where we are not even like, we are like zero. So we are still way behind. So there are things, sorting out the challenges should be our priority to move forward into this digital transformation world.
It's all right. Thank you so much, Tosin Akinlabi, for coming on the program today, and we wish you well in all that you do. And we are hoping that sometime your digital nursing experience and skill, you will scale it down to Nigeria, and some Nigerians will be able to benefit from that as well.
Yes,
Thank you very much. Thank you for coming.
Thank you so much for having me.
Great.
Thank you.